think we have a few folks that may still be out, but in the interest of time, I will go ahead and introduce our next session, which is focused on CDC funding opportunities for tribes. As you can read on the agenda, grants and cooperative agreements are mechanisms used to transfer federal resources in exchange for services that help fulfill CDC's mission and are direct benefits to the public. CDC's Office of Grant Services, OGS, as we call them, coordinates and oversees all funding provided through the various CDC mechanisms throughout the life cycle of the award. OGS staff is here to present on funding that CDC has provided to tribes, funding that is available to tribes, and some keys and tips for tribal communities and organizations that receive CDC funding. Today we have our presenter, our very own Jamie, make sure I say this right, Leger. Please forgive me, Jamie, for that. Just a little bit about Jamie, and she'll tell you more about herself when she comes up. She is the Deputy Director of Global Operations for the CDC Office of Grant Services and Office of Financial Resources. She has over 35 years of experience working in the federal government and has served at CDC for 25 years in several capacities, ranging from acquisitions, systems, data, performance management, policy to grants management. Lots of history, lots of experience, and I'll present our very own Jamie. Come on up.
Good morning still? Yeah, I think it's still morning, and thank you. Yes, just to tell a little bit more about myself, Jamie Leger. I've been at CDC since 1998, started when I was 26, let other people figure out the math. And I started in acquisitions as a contracting officer back in 98. I actually came from Alaska, where I was there for 9 years, working as a contracting officer in the procurement office for the Department of the Air Force. And I had the opportunity to visit a lot of remote areas while I was there. Beautiful, beautiful state. As my bio says, I've worked in a lot of different capacities at PGO, which is now the Office of Financial Resources, acquisitions, policy, systems management, data management, IT, landing in grants in about 2013. And I started out working, supporting CDC's full global portfolio. We're in about 90 countries. Landing in my position now as a deputy director for global, but don't let that title fool you. I actually support the new Public Health Infrastructure Center and all of their domestic activities, NCEH, and a few other domestic centers at CDC. And my counterpart, Carla Harper, was not able to make it here today. And I also want to say thank you for inviting me to this summit. I feel like, and I was telling Audrey this earlier, I'm learning way more than anything I can communicate today. I'll tell you a little bit about CDC and funding and maybe answer some questions, but I feel like it pales in comparison to what I'm learning here today. And I hope we're invited to future events like this, because what it's going to allow me to do is take back what I've heard here to the staff, our grants management staff that work with our counterparts, and give them a little bit more of a deeper dive into the work that they're doing and the impact that it has working with the centers on public health and all the activities that go on. So this has been a great experience for me these 2 days. So I want to thank everybody here for the information that you're sharing. We're going to go, slide, and I'm horrible for that. I'll give you a little introduction to grants at CDC. We'll talk a little bit about pre-application, tips for applying for grants. I feel like I may be preaching to the choir a little bit because a lot of you work for federal organizations or organizations that already apply for grants, but we'll go through those maybe not as slow as I thought I might need to, and what to expect as a CDC recipient, and then I'll have a few slides with some useful resources. Next slide. And we'll go into a little bit of you can go to the next slide, introduction of grants at CDC. I know many of you are familiar with CDC. You work with NCEH and ATSDR, but I'll give you a little bit of background about some of the grants that are managed at CDC, our profiles, where CDC is the nation's premier organization or federal agency for health promotion, prevention, and preparedness, and we're a global leader in public health. We're globally recognized, conducting research, investigations, and for the action-oriented approach that CDC takes to research and applying findings to improve people's daily lives in response to public health emergencies. Something that distinguishes CDC apart from other agencies that, we feel. As you can see in the slides, we manage, did I do that? We manage about 6,000 grants that are awarded to about 2,500 plus recipients that generate over 14,000 grant actions a year. Last year, we obligated about $9 billion to public health organizations for programs and research around the world. And over 75 million, which seems like a small amount in comparison to what we obligate on an annual basis, to over 102 tribal organizations on an annual basis. And we publish anywhere between 100, last year there was 107 to 150, sometimes even upwards of 200 new notice of funding opportunities a year. Next slide. The next two slides, I just have some information about some of the current tribal funding and public health initiatives that are out there. Good health and wellness in Indian country, supporting tribal public health capacity in coronavirus and preparedness and response. That's actually a COAG that was issued during the height of the pandemic. Most of the COAGs under that or grants under that program are closing now, it's at the end, but it was our largest program to date. We funded over 340 tribal organizations during the pandemic, in addition to our regular programs that we have. And we learned a lot with that program. We learned what we didn't know about working with tribal organizations, and we held a lot of seminars and webinars and provided a lot of technical assistance over the past few years through that particular COAG. There's an Epidemiology Center's public health infrastructure program where we fund about $8.5 million a year. Next slide. A couple of more programs that we're working on that are in progress. The last one on the list there, that's a new NOFO that's in the process of being awarded as we speak. There's actually going to be 26 federally recognized tribes awarded under that new COAG. It's going to start out at about, I forgot what the total was initially. It's about 2 or 3 million initially, but then there's going to be another 25 million obligated under that COAG this year. This is August next month. So that really is going to rival the first COAG that was on the first slide as far as a large program that we have in place. Next slide. Shay, I don't know if this web page is the same web page that you were referring to yesterday. Okay. So this is a repeat of Shay's part of the presentation where she talked about a slide that we have available for tribal information, data, and resources on CDC's website. I don't know if you can click and go on the bottom of that and go to the link or not, but when you go to the main page, there's actually a, I don't know if you're trying to do that. There's actually a link for, that's in the blue box, budgets, grant, and funding. There's a lot of information on that particular page. Okay, all right. That's just useful information about what we currently fund at the agency. Yep. If you scroll down and inside that blue box where it says more, up above in the blue box there. Yep, sorry about that. We didn't practice. I just wanted to show this page. There's a lot of information there about upcoming funding opportunities, funding profiles, which we're a little bit late in getting some of that information published. It's information about funding going to tribes and tribal organizations. As you can see, we only have information posted to 2020, but I do know that we're working on getting 21 and 22 posted soon. I just wanted to show this page, and there's a lot of information and resources about funding going to tribal organizations. And we can go back to the slides. And we can go to the next slide. I'm not going to spend a lot of time here. This is just a slide that talks a little bit about the types of assistance and funding that we grant. And Shay, you touched on this a little bit yesterday as well. Difference between grants, cooperative agreements, and acquisition. And as you know, I work in the Office of Grant Services. We're really looking more towards putting more grants out the door, which allows recipients and the communities to come in with approaches to how they would address a scenario that CDC is putting or requesting or offering funding for. Let you tell us how you're going to be able to accomplish those, and then measure how you're doing that. But we are a cooperative agreement laden organization, because there are some programs where we still are going to have to, we're not going to be able to get away from working collaboratively on those types of activities and programs. Next slide. This is a slide that just depicts how we work with you as recipients, how CDC works with you once a grant is, or a cooperative agreement is issued. You work with the program offices like NCEH on approving your plans prior to award. We conduct site visits. We monitor the work that's doing in our office. We monitor for compliance and making sure that you're meeting the objectives of what's in the terms and conditions of the award. One thing I don't like to focus on is conducting enforcement activities, because ideally that's something you'll never really have to deal with. And we also participate in closely monitoring on the basis of any corrective action plans that might have to be put in place if we've got to do enforcement action. But I really don't like focusing on the negative. Really, we work with you as a partner to ensure that you're successful or recipients are successful in achieving the goals and objectives of the program, because if you're successful, then CDC as an organization is successful. And we also work with the program offices to provide, or the organization's, technical assistance prior to award and post-award, and work with the program offices in reviewing and evaluating performance to ensure project objectives are met. In all, you know, I'm struggling in talking about us as an organization, because it always seems like we're compliance, we're the heavy hand. And in hearing everything that the groups over the past 2 days, today and yesterday, have been presenting, it's all about the positive things that can be done and need to be done in these communities. We are compliance. We do make sure that the funds are used for the purposes that they're meant to be used for, but we do that in, you know, coordination with the organization to ensure success. You know, I really, not just to be on the negative side, but the positive point is having that positive impact on public health. Next slide. Recipient roles and responsibilities. And I feel like I'm talking to a group of organizations that aren't necessarily the recipients. So I feel like, in a way, that this information may not be for this audience. It may be targeted at a different audience, but however, this is a slide we put together. The recipient roles and responsibilities develops and implements the systems and monitoring procedures to ensure that you are implementing proper stewardship over the funds, identify areas of special interest, and communicates regularly with the CDC project officer and your grants management officer, track your performance, accounts for funds to CDC, and is responsible for your subrecipient and subcontractors, and to ensure that you comply with all the terms and conditions of the award. Next slide. I do want to ask if there's any recipients in here or organizations where tips for pre-applications and how to apply for a grant is going to be useful to you. It's kind of what I thought. Everyone here is a FED or an organization, but there are basic steps, and I'll go through this fast. I'm going through all of this fast for that same reason. Get to know grants.gov, make sure your organizations are registered in sam.gov. And then one thing that's very important is when there's a notice of funding opportunity announcement published, make sure that you totally read thoroughly through it to understand what's required to, one, submit an application, and two, completely understand what you're responding to. Next slide. Grants.gov. Is anyone in here not familiar with grants.gov? Okay. Well, I'll go through this one quickly too. It's our first stop where we post all our notice of funding opportunities announcements, and allows recipients and organizations to respond and submit applications in response to the notice of funding opportunity announcements. I won't go through all the steps for that if everyone here is familiar with it. And the next few slides that we can skim through just show you how to search for grant opportunity announcements. We can, search for grant opportunity announcements, how to drill down and look for the agency that you're looking for grants announcements for, and then how to apply. There's even links on grants.gov that provide training on applying, how to set yourself up to receive notifications for grants.gov. And I think there's the second stop here, which is the slide, is sam.gov. And same type of thing. There's information about how to prepare and register for in sam.gov. I will say here, and I don't know if any of the organizations that you work with have issues, but we're starting to see a lot of issues where entities are having issues registering with sam.gov. It could be because they're not providing the proper documentation that GSA is asking for. There may be and I'll give an example. There's an organization who's been registered with sam.gov since 1971, and then all of a sudden, one word in the title of their organization got truncated somehow, and so they've not been able to complete their registration, and it's impacting their ability to get federal funds. So I would say start early, try and figure out where there are issues, if any, with your ability to register with sam.gov. We are not the help desk. OGS is not the help desk for sam.gov, but we will work and try to provide as much assistance as we can in trying to get registered. But I would just say start early when it comes to trying to register for sam.gov. We can go to the next slide. When you're applying for a grant, just one of the things I mentioned earlier is make sure you completely read the NOFO so you know what's required. There are certain forms. These are what's listed here are common forms that are going to be required for any application submitted to grants.gov. There may be other forms or information or documentation that you need to provide, but make sure that you include everything, because if you're missing one thing, it could deem an application not responsive and it won't go through the process. Next slide. And this is just information on additional information on grant writing tips. It's on our website. You can go to the website and access this information. So, and I apologize for going through some of this fast, but like I said, I feel like I'm not talking to the audience that would be the one applying for grant applications, and that information may not be useful to you. What to expect. Grants welcome packet overview, what recipients can expect. Information about if you already have a CDC grant, there'll be information on this webpage about if you don't have a grant, who your points of contact could be, what the information, information about a cooperative agreement, how CDC manages cooperative agreements, and again, what your roles and responsibilities are. If you can go to the next slide. The Federal Grants Management Training Series, it is a series developed by the Department of Health and Human Services in conjunction with other federal agencies. This is a good resource for training, and I do suggest that all potential applicants and recipients sign up to take this training. There's several modules that are available to recipients. It's available to anyone who works in the grant community, especially, well, not especially, including recipients. It gives you training on federal grants basics, grants 101, walking through a notice of grant awards, budgets, how to deal with subrecipients, and then basic information and courses on federal grants management. So this is a good resource and a good training. I do recommend that everyone, every recipient, and if you can share this information with those organizations that you work with, that and if they're able to, that they sign up and take for these trainings. Next. And I think I walked through a 50-minute presentation in about 20 minutes, but the next two slides are just useful HHS resources, just links to different information, the HHS grants information, the public health policy statement, which is in the process of being updated. It's been in the process of being updated for about 10 years, but I think at some point HHS will get there. Our CDC website and our CDC grant information webpage. And I think that is probably my last slide. Yep. I see two hands for questions in front of you, Shay.
JB, I appreciate that presentation. Quick question. I think it's a quick question. I know we normally hear about grants.gov, and if I'm not mistaken, HHS oversees grants.gov. What is the difference between grants.gov and sam.gov? And is there a different entity that oversees sam.gov?
Yes. Grants.gov is a website where all HHS and operating divisions post their federal funding opportunity announcements. And it's the website where if you want to respond to those announcements and submit an application, where potential applicants and recipients can submit their applications. In a nutshell, that's what that website is. It's where we post our opportunities and it's where you apply to it. That's grants.gov. And all HHS opt-ins, operating divisions are required to use that website to forecast and post funding opportunity announcements. sam.gov is managed by GSA. It's owned by GSA, and that is a website that combines several websites where potential applicants for either contracts and or grants have to register in order to receive federal funding. It rolls in, it's where you get your UEI, the unique entity identifier. It is where information about excluded parties, or if you have any reason that would prohibit you from receiving federal funds, that information is captured there. The central contractor registry, which doesn't apply to most grant applications, but sam.gov is a website that rolls all those entity management, award management applications into one. And you have to be registered as a recipient or an applicant with sam.gov in order to receive federal funds. And if you're not registered with sam.gov, you're not going to be able to apply for grants on grants.gov. Thanks for asking that question. I do have something that I did want to talk about earlier in this slide before you go, Shay. Notice of funding opportunity announcements are written with a lot of legalese and a lot of, this is a CFR, this is how we have to say this is HHS policy, this is how we have to structure this. And it could be very confusing and very convoluted in a notice of funding opportunity announcement. And a lot of times what we're asking to be accomplished is written in such terms that it's not easy to translate or understand what's exactly being asked for. So actually NCEH piloted with a NOFO with HHS on plain writing. And the objective is to write a notice of funding opportunity announcement the way any person might read and think, and you don't have to try and figure out what it is we're saying with these 30-cent words and terminology, what's being asked for and interpreted incorrectly. And that NOFO is in the process of where it's at in the process is it was posted, applications were received. I believe they're being reviewed right now. And we're really excited about the way this NOFO was written and published because it really does communicate in plain language. And we've gotten a lot of good feedback from the applicant community so far. HHS is piloting this program with 4 operational divisions under the department. And we're hoping that in the future, this is what our NOFOs are going to look like. I mean, there are so many times when information is interpreted incorrectly and there's just miscommunication about what's being proposed and what's being asked for. And it takes a year to figure out what we're really doing because we weren't clear in how we communicated what we were asking for. So I'm really excited about that program. I forgot to mention that early. I was so worried about communicating information that you guys, preaching to the choir, I was going too fast through my presentation. So pardon me for that. Go ahead, Shay.
So basically, thanks so much, Jamie. Basically, SAM, if I can put it in how I think of it, is where I get my driver's license. And once I get my driver's license, which has, everything on there, my birth date, my address, whether I'm donating organs or not, all of that collective information. Once I have a driver's license, then on grants.gov, I can choose what car I want to lease or apply for, right? So I'm just trying to put things in, relationship. Grants.gov also has pick list, right? So for those of you who are not necessarily or are from like a state entity or whatever, you can share this information to your network and your state. Because when states apply for funds, they apply and they include the American Indian Alaska Native population. How are you working with the tribes in your state boundaries in order to plan for those programs? So grants.gov, you can set up an alert system, if you will. You tick the box, right? Click, click, click. I want to know from HHS, from CDC, from Substance Abuse Mental Health Service Administration, SAMHSA. You can click all the little boxes. And then you can say, a subcategory of that. And then you can set up whether you want daily alerts, weekly, monthly, never, ever, ever. If you put never, ever, ever, why did you pick the boxes, right? However, you then get those notifications in your email. So even though you may not be particularly particularly looking for a grant from CDC as an entity, you may want to go in and set up those alerts because then you can send those out to your network, right? It's all about relationships. I know something, I share it. Jamie knows a lot. She shared a lot today, and we thank her for sharing her knowledge. So the ask, sign up and share then what you know with your network, your people, your partners, your potential partners. The other thing I wanted to mention is that As Jamie indicated, we don't want to focus on the negative outcomes that could be, like a corrective action plan or something like that. But we have project officers that are working with entities, whether they're grantees or our COAG, again, 50-50 partnership, and try to avert and re-steer and provide technical assistance before it ever gets to the point of a corrective action plan. So if I'm a grantee and I said I was going to do 100 widgets and I'm only at 50 widgets, I can ask my project officer, help me restructure. How can I possibly get back on track?
Mhm.
So we provide that kind of technical assistance way before any kind of corrective action plan occurs. The other piece that I think is really important is that our Office of Grant Services, which is where Jamie's at, when they receive the applications, they have to review them. They have a huge workload, right? So we all submit, just as an example, every one of us in this room submit a 100-page application. Now, the narrative and the work plan is limited to so many pages, and then you have appendices and et cetera, et cetera. They have to look at all of that to make sure you have included every single thing that was required. Otherwise, your application is deemed ineligible. That's a lot of work. It's a lot of work, right? So, well, Jamie went flying through those slides and makes it sound so simple. I want to say there's two places I never want to work: HR and OGS, because of the workload. The other challenge that I think that we are internally trying to figure out, how do you do this, is that the whole of federal government, whether it's Department of Transportation, Health and Human Services, Department of Interior, and et cetera, we're all on the same fiscal year. It starts October 1 and ends September 30th, right? So all of our NOFOs pretty much hit the street about the same time, around the same time. So as an entity, you have to wisely choose which are you going to apply for, because we know there is no way that any of us, including the great Navajo Nation, which is huge, has enough grant writers on staff to apply for all of the available funding from all of the federal government. But those alerts in grants.gov will help. And when you utilize data and you utilize our data access system and you look at health disparities on that webpage that Jamie showed and I showed, you can go there and click on health disparities. There's not a single thing in the world of environment that does not affect or effect health. It's how you make that narrative connection to doing, whether it's cleaning up something, checking for lead base, but there's a purpose that we set for each grant. And Jamie talked about that. Are you meeting the purpose and objective of the grant itself or cooperative agreement? We would really like at CDC to do a tribal set aside of our funds. The problem for CDC is that when we get funds from Congress, there is particular language that comes with those funds, and it's for specific diseases or efforts, not populations. So how we're trying to figure this out? How in the world? Because we hear it over and over and over that the tribes want CDC to do a set aside of a 5%, 10% of all of our funds to go into Indian country. There is not a person inside CDC that I have ever met that does not believe that Indian country has a huge need and has a very high bar of vulnerable communities. The challenge is, how do we stay within our Code of Federal Regulations, CFR, and the language that comes with the funds from Congress on what we're supposed to do with those funds? We need your help with that. If you have ideas, how can we possibly do that? That's that feedback part, right? And again, Jamie and her team, and it's, none of us work in a silo, but the Office of Grant Services is a wonderful place, and I would work with them. I just wouldn't want to do it at particular times when all of these huge amount of applications come in. And they have a number of well overworked staff, let's say that, but they're very dedicated as well. Any other comments or questions for Jamie? I want to thank you for coming. That's number one. And number two, for your presentation and always your dedication. Thank you so much, Jamie. Round of applause for Jamie.
Thank you, guys.
I think we are now at break time. We're just going to take a quick, and I do mean quick, 4 minutes, not 5, not 6, not 3, but 4. That's right, brother. 4-minute break. When we come back, please sit into the circle, and we will conclude the session virtually now. So thank you very much. Again, during your 4 minutes or 3.5 minutes now, please make sure that you've let the registration table know one last time, if you have not already, whether you're joining us at the Heard Museum. See you shortly in the circle. Thank you.